Hi guys, welcome to Focus and Flow lectures. Today we are going over the Gastrocnemius strain or gastroc strain. What structures are injured? So the Gastrocnemius strain is an injury to the gastrocnemius muscle, and it occurs if the muscle is stretched too far, which causes tears to occur within the muscle. The gastrocnemius and soleus muscle, but it most commonly occurs in the medial gastric muscle. The mechanism of injury. It is common in sports such as running, soccer, and tennis. Also, it can occur when there are sudden changes in direction. When running, it can overstretch the muscle and lead to a tear, especially when flexing the ankle and extending the knee at the same time. Clinical features or signs and symptoms. So you may have pain in the back of the leg, more on the inner part of the leg or the medial aspect of the leg where the calf is, and then you may have swelling of the calf, bruising of the calf down to the ankle, and you may hear an audible pop at the moment that the injury occurs. Epidemiology. So it occurs in athletes usually over the age of 30 years old. Treatment. So you want to look at muscle testing, the strength and the length of the muscles. You can incorporate special tests such as the anterior draw test. You can incorporate massage and exercise. So stretching against the wall, stepping up onto the exercise stepper and raise onto your heels. And then you can do it unilaterally and raise up on one heel. There's sprinting position where you lift one foot off the floor repetitively. And then we also have hopping in a star formation. I want to say thank you guys for listening to Focus and Flow lectures. Please like, share, and subscribe. And I hope you can tune in more to learn from these lectures. Thank you guys, and I hope to see you in the next video.